Okay, welcome guys to our today's session. I'll be discussing on enteral nutrition. So someone tell us something about enteral nutrition or what they understand about it. Someone in the class?
Enteral nutrition is delivery of nutrients into the body through the digestive system.
Okay, thank you, Dorothy. Yeah, enteral nutrition is basically administration of nutrients to the GIT system. So for today, we have two learning outcomes. One is by the end of the session, you should be able to explain the meaning of terms applied in enteral nutrition. Two, you should be able to identify enteral nutrition or tube feeding routes. So we'll start the session by definition of terms. So enteral nutrition, this is a way of providing nutrition to the patients who are unable to consume an adequate oral intake but have at least a partially functional gastrointestinal tract. So for it to be enteral nutrition, the GI has to be partially functional and the patient is not able to consume adequate nutrients orally. It's recommended for patients who have problems chewing, swallowing, prolonged lack of appetite and obstruction, or altered motility in the upper GIT. So another term is on tube feeding. This is delivering of food by the tube into the stomach or intestine, indicated whenever oral feeding is impossible or not allowed. Okay, for enteral nutrition to be carried out, it is done through tube feeding. So sometimes that's why it's referred as tube feeding. Then we'll continue definition. We have endoscopy. This is a procedure in which an instrument or endoscope is introduced into the body or organ to give a view of its internal parts. So for some of the tubes to be inserted, we have talked of the tube feeding, we have to do an endoscopy. So during that process is when we insert the tubes. Another term is pylorus of the stomach. This part of the stomach that connects to the duodenum. Duodenum is the first part of the small intestine. Okay, this pylorus is more of a valve that opens and closes the stomach so that the partly digested food is delivered to the duodenum. So our next outcome is on the types, identification of the different types of enteral nutrition or the tube feeding routes. So we have two of them. One is mechanically inserted tubes and the other is surgically inserted tubes. Who can try differentiating these types of tubes? Someone in the class. What do you understand by mechanically inserted tubes and surgically inserted tubes?
I have a contribution.
Yes.
So I think that mechanically inserted tubes,
yes,
are the ones that are fixed without necessarily going into theater, whereas the surgically inserted tubes, one has to go to theater for some sort of a surgery for the tubes to be inserted.
Yes, thank you, Mercy, for that response. Okay, mechanically inserted, these are done more manually. You don't have to go to a surgical room or a theater for them to be inserted. And these are usually short-term or temporary feeding tubes. Then they are inserted through the mouth or the nose. Then the surgically inserted done during a surgery. You have to undergo a surgery for them to locate. Done following an endoscopy, which you have said that is a procedure that you have to look at the internal parts before inserting the tube. Okay, are we still together? Are we together?
Yes, madam.
Okay.
Yes, we are.
Okay, then the next one is on, these are the different routes of enteral nutrition. So from the diagram, which ones do you think are mechanically inserted and which one do you think is surgically inserted? Someone to give me one of mechanically inserted and another to give me a surgically inserted tube from the diagram. Someone in the class?
Gastric is mechanically inserted.
Which, Dorothy?
Nasogastric is
Yeah, that is very good. Nasogastric is mechanically inserted. We have said for mechanically inserted, they are done through the mouth or the nose. For example of a surgically inserted tube, Mercy.
I have a contribution.
Yes, scholar.
The one that is written is gastrostomy tube.
Yeah.
It's surgically inserted.
Yes, that is very good. Gastrostomy is surgically inserted. Even as you can see from the diagram, it doesn't go through the nose or the mouth. It is done somewhere around the abdomen. So I would like us to define the mechanically inserted tubes. As you can see from my slides, I have mechanically inserted tubes that include nasogastric, orogastric, nasoduodenal, and nasojejunal. So we'll look at this from the diagram. For nasogastric, it is done from the inserted in the nose all the way down to the stomach. Then orogastric is inserted from the mouth all the way to the stomach. Okay, gastric stands for the stomach part. Then we have nasoduodenal. This is done from someone? Nasoduodenal.
From the nose to the duodenum.
Yes, from the nose to the duodenum. Duodenum is the first part of the small intestine. Then we have nasojejunal tube from the nose directly to the jejunum. But for this in jejunum, you have to follow an endoscopy because you have to go past what you have called the pylorus. So you have to follow an endoscopy so that you can see the internal part of that area where you are going to push the tube to. Then for surgically inserted tubes, you already given an example on gastrostomy. So others are esophagostomy. Then we have jejunostomy. So from the diagram, there's a small task for you. For esophagostomy, where is that tube inserted? Esophagostomy. It is not in the diagram, but I would like you from that name, where is it inserted?
Esophagus.
Yes, esophagus. So that is the surgical tube. So it will be done somewhere near the neck, directly to the esophagus. You can see maybe this diagram I've shown them. Then the other, we have jejunostomy. This is done directly into the jejunum. So this is done surgically. Gastrostomy is done directly to the stomach, and it is done surgically. Okay, do we have question up to there? Anyone with a question or a point of concern?
I have a question.
Yes? Yes, Dorothy?
I'm asking.
Yes.
Is gastrostomy used feeding or for ventilation?
For gastrostomy. Okay, gastrostomy can be used for feeding. And then
For esophagus.
for esophagus.
Yes.
Okay, in some cases, you can get the upper part, maybe the nose or the mouth. Maybe someone has maybe cancer. So maybe those parts cannot be used. So they'll either do esophagostomy, or the others that will use that for ventilation, maybe for breathing, because once the tubes are inserted, the breathing becomes difficult. So I think it can be used in both ways, but you can research more on that. Research more on that. Okay, are we together, Dorothy?
Yes, thank you very much.
Okay, we are welcome. So, having no other question, I would like to leave you with a small assignment. This is the assignment. In our groups of 5s, I would like you to discuss types of enteral nutrition formulas, stating the examples. This following, us as nutritionists, we have formulas that we are going to feed, that we are going to use the tubes to feed the clients. So I'd like you to discuss the types of enteral nutrition formulas, stating example. You can use the clinical nutrition reference manual for your reference. and their assignment is also in your LMS. So the assignment will be collected during our next lesson. So thank you so much for attending this lesson, and I wish you a lovely evening.